Well, if you didn't catch the clues from our pink outfits, I'll just go ahead and tell you Valentine's Day is approaching and Dr. Emami is helping us all get ready. We are talking lips today and we are at AURAE MD in La Jolla. So when it comes to prepping for Valentine's Day, we are timing this segment just right. There's still time for all of us to get our lips smooch ready.
Yes, absolutely. This is prime season for kisses. So we're thinking pink, we're thinking red, we're thinking of all those beautiful lipsticks that we can put on. So we're gonna put on those lipsticks, we want to put them on beautiful lips because no one likes when their lipstick runs or gets into those fine lines around the mouth. And of course, we always want to present ourselves in a naturally beautiful way.
And I love that you are all about enhancing that natural beauty that we all already have. So if I were to ask you, what's the perfect set of lips for me? You'd say the pair you already have, right?
Exactly. Why? Because I can't change your natural lip shape. I can only augment it in terms of volume and then take care of fine lines and wrinkles. And that's one of the beautiful things that filler can do. It can give structure back to a lip for somebody who's maybe getting a little older. It can give fullness to a lip for someone who's young, or also we lose a little bit of fat in our lips and we want to give a little bit of fullness. And then for those little lip lines that we get, it can solve that problem too.
I love that. And I also love that you really take time to meet with your patients, and you've described fillers and other injectables as working with somebody who has the right paintbrush. So describe that analogy to us.
Yes. So if you're going to do a painting, number one, you'd want to start with a very high quality paintbrush, and not just a high quality paintbrush, but the right paintbrush. So you want to choose a filler that is made for the lips. And then you want to make sure that it doesn't matter how good your paintbrush is if your artist isn't skilled at painting. So you want to make sure you have someone who really understands the anatomy of the lip. This is a really common question. Is everybody going to know, and is my boyfriend going to feel it? And I would say lips done perfectly, no one will know and no one will feel it.
Nice. So what is it that we need to keep in mind when we're looking at the mirror? How do we know it is time to make that call to someone like you?
Well, number one, if you are seeing your lipstick running and getting into those lines, that's a really good indication. Or if you're starting to see those little fine lines, what we call barcode lines, going across the top of the lip and sometimes the bottom of the lip, that's a good time. And lip filler appropriately placed can really combat that. And sometimes we just want our lips to look a little bit more glamorous, and just the right amount of filler in the right place can give you that little bit of oomph.
When it comes to injections and different lip treatments, what on average is the time we're going to get out of this?
Well, filler in the lips tends to last shorter than filler in other parts of the face. Why? Because we're always moving our lips, we're talking, we're eating, but the really good fillers today that are indicated for lips and FDA approved for lips can last up to a year, which is really great. So you never want to overfill the lips, but if you fill the lips appropriately, you can get some very nice longevity.
And are lips something that you can add more to later? Like say I came in and we did something super natural and then I'm like, you know what, maybe I want a little more. Is it something that you can touch up over time?
Absolutely. And in fact, this is the way I recommend that you do it. I never do more than one syringe of filler in the lips. We never want to overfill the lips. So you start with a mild to moderate amount that's appropriate for you, and then you can always go back and add more.
All right, I feel like I just let everybody at home sit in on my consultation. I got all my questions answered. I may be booking an appointment soon. Is there anything else that we all need to keep in mind?
So this is a medical procedure. So you want to make sure that you have enough time for the lips to have their natural swelling, because this is hyaluronic acid that we put in the lips. Hyaluronic acid will swell for a couple of days, so you don't want to do it right before a really important event or the day before Valentine's Day. This is why we're talking about it now, early February, so this is the sweet spot. And then you can get a little bit of bruising because the lips do have a lot of blood vessels, and so you want to make sure you give about 2 weeks for any bruising to go away so that things are picture perfect when you need them to be.
All right, Dr. Emami, as always, thank you so much.
You're so welcome. It's my pleasure.